What if the thing keeping someone alive is also the thing the recovery community keep arguing about? Medication assisted treatment. MAT, methadone, Suboxone, Vivitrol. See, some people call it life-saving. Some people call it replacing one drug with another. Some doctors support it, some question it. Some participants say it gave me my life back, and others say I feel trapped. So today, we're not doing the easy thing, folks. We're not doing the easy thing. We're not bashing MAT. We're not worshiping MAT. I'm telling the truth, my opinion. Because if the only goal is to keep someone alive, that matters. But once they're alive, we have to ask a deeper question. Are we helping them rebuild? So welcome to True Healing and Recovery with your boy, Coach Mike Rowe, where chains break, minds wake, and purpose takes its rightful place. MAT, or medication assisted treatment, right? It uses, what is it, guys? It uses FDA approved medications like methadone, buprenorphine, Suboxone, right? Vivitrol to treat opioid use disorders. SAMHSA states that these medications help normalize brain chemistry. It helps reduce cravings. They block the euphoric effects, and it supports recovery, right? That's SAMHSA. SAMHSA also makes it clear that these medications are evidence-based and are not simply substituting one drug for another. That's SAMHSA, right? But here's the key. Here's the key, folks. MAT is not supposed to be medication only. The original idea is medication plus counseling, plus support, plus behavioral health, structure, accountability, and life rebuilding. That is where I'm starting to see the disconnect begin. That's where it starts, I believe. So the pros of MAT. Okay, let's talk about the pros of MAT, because we have to be fair, ladies and gentlemen. MAT saves lives. It saves lives, right? The CDC reported that methadone and buprenorphine substantially reduces overdose-related and overall mortality. So if you're into the statistics, the CDC, they reported this, right? I think one major NIH supported study, it found that after a non-fatal overdose, methadone was associated with a 59% reduction in opioid overdose deaths. And buprenorphine was associated with a 38% reduction over 12 months compared with no medication. So listen, before we criticize MAT, we have to acknowledge this. We have to acknowledge a dead person cannot rebuild. A dead person cannot go to therapy. A dead person cannot restore their family. A dead person cannot rediscover purpose. MAT can help people stabilize long enough to do the deeper work. Common benefits include what? Reducing cravings, reducing withdrawals, lower overdose risk, better treatment retention, less illicit opiate use, more stability for work, for housing, for parenting, mental health. And for some people, MAT is the bridge between chaos and stability. Those are the pros. Now, here is where we have to be honest. The cons and the real concerns. Okay? Let's be honest. Hear me out, guys. Thank you for those of you that are totally against MAT. Thank you for lasting this long. MAT has real concerns. It does. Some people become physically dependent on this medication. Some feel emotionally stuck to it. Some feel judged by other recovery spaces. Some people feel like their provider only checks the medication box, right? They only want to keep them on that box and that medication. Some experience side effects. Guys, ready? Some experience side effects like fatigue, constipation, sweating, the low energy, emotional numbness. These are all reports. Some struggle when insurance lapse, right? Medication is delayed, access gets interrupted. And that's a big deal. See, that last one that I just mentioned is serious, folks. It's serious. If someone's entire recovery stability depends only on the medication being available every single day, then what happens when there's an insurance problem, a pharmacy issue, a clinic closure, transportation failure? That does not mean MAT is bad. It means MAT must be connected to a larger recovery plan. Why are people so negative towards MAT? That's the question. I believe there are several reasons. First, stigma. The National Academies report that stigma towards methadone and buprenorphine is often rooted in the belief that these medications are just substituting one drug for another. I've heard that. I believe that at one point, and I hear it constantly this past year that I've been an MAT intensive case manager. Second, lived experience. Some people have seen others misuse the medication, sell the medication, over-sedate, manipulating the dosage, or staying stuck without doing recovery work. And that shapes opinions. It's there. It's true. Third is recovery identity. Some abstinence-based spaces define recovery as being completely free from all substances. So when someone says, man, I'm in recovery and I take methadone or Suboxone, some people reject that. And then fourth, There's a mistrust of systems. This is one that I constantly hear. People believe that the clinics, the doctors, the pharmaceutical companies, insurance system profit from long-term medication. Listen, that suspicion is not always coming from nowhere. Healthcare is a business, but we have to be careful not to let distrust erase evidence. See, the question should not be, are doctors making money? The better question is this person safer, more stable, more functional, and being offered full recovery support? Some participants say, and I'm grateful, guys. I had a very negative outlook on MAT through personal experiences. Not that I was on MAT, but um, someone close to me. And I did not understand the concept. So a lot of this stuff that I'm talking to you about is from my lived emotional experiences. And my life's changed in the past 2.5 to 3 years. The doors have been open for me to uh, find footing in the recovery world as an MAT case manager. And I came into this, looking in such a negative way. But a whole different light was shined and a different understanding. And I get to hear testimonies from men and women, some from participants that say MAT gave them their first real chance. Some of them say, hey, before MAT, all I thought about was getting high or not getting sick. This medication gave me space to think. I got my kids back. I stopped running the streets. I could finally work. I stopped waking up in a panic. Those experiences matter. Those real life testimonies from the individual themselves mattered to me and started changing my perspective because I saw how it was working. See, a systematic review of patient and provider perspectives found both positive and negative views of methadone, buprenorphine, Vivitrol, with misinformation and stigma commonly appearing across the literature. So we can't reduce this to one story, folks. We can't. For some people, MAT is freedom. For others, MAT feels like another chain. Both experiences need to be heard. Some participants, let's talk about negativity. I'm fair. I'm transparent. I'm not leaving none of this out. I just mentioned some positive, right? Let's talk about the negative participants, the negative experiences from the participants. Some say, man, I feel dependent on the clinic. I feel judged wherever I go. I've heard that. Another gentleman just said, I just don't feel clean. I'm scared to come off. I don't feel like anyone is helping me heal mentally. I'm stable, but I'm not growing. I've heard these comments from men and women that I have to listen. See, and that last line is powerful. I'm stable, but I'm not growing. that is where the recovery, I think, see, that's where the recovery community has to step in, guys. Because stability is not the finish line. Stability is the foundation. Look, let's talk about the medical providers. Many medical providers, what I've seen, have strongly supported MAT because the data is clear. The data is clear, right? Methadone, buprenorphine, it reduces death risk and improves retention, right? NIDA, it recognizes methadone, buprenorphine, Vivitrol as effective FDA-approved medications for opiate use disorder, right? But some providers remain hesitant. Why? Why? Lack of addiction training, fear of overdose risk, fear of diversion, bad experiences with patients that were misusing the medication, belief in an abstinence only model, fear of managing complex trauma, mental health, and substance use altogether. It's okay. The National Academy of Medicine identified barriers like stigma, inadequate clinical training, lack of addiction specialists, poor integration of MOUD into the practice, financial barriers. So sometimes providers are not against recovery. They're just undertrained. They're overregulated. They're cautious. They're biased. They're burnt out. But that still affects the patients. I want to be clear. See, this is where I speak from my experiences. Working as an MAT intensive case manager, I see the benefits. I see people who are alive because of MAT. I see people who are stable. I see people who are not chasing the street anymore because of MAT. But I also see something missing. I do. Medication can definitely quiet the craving, but it doesn't automatically rebuild the mind. Medication can stop the withdrawal, but it doesn't automatically heal trauma. Medication can stabilize the body, but it doesn't automatically teach emotional regulation. Medication can keep someone alive, but it does not automatically teach them how to live. That, folks, is where true healing and recovery come in. Listen to what I'm telling you. We need behavioral health, trauma work, peer support, case management, spiritual growth for those who want it, family restoration, employment support, housing stability, coping skills, identity reconstruction, emotional regulation, purpose, accountability, community. MAT may help stop the bleeding, but after that, we still have to treat the wound. That, let me give you an example. A participant, I was helping a participant trying to get his medication. There was some kind of insurance issue. I don't know all the details, don't know why, but there was an insurance issue. And it got to the point where he almost couldn't receive his medication at that moment. And I think he was 2 days without his medication. He started already feeling the withdrawals. And you listen, anybody who knows opiate withdrawals knows it's not just discomfort. That's a panic. That's body pain. That's fear. That's desperation. It's relapse risk. That's the relapse risk knocking on the door. So while we're handling all of this, I asked him a personal question. I said, what steps are you taking outside of this medication to grow? What are you learning about yourself? What areas of your life are you rebuilding? What happens if the medication is not available one day for you? This is not anti-MAT. This is pro-recovery, folks. Because if the medication is the only pillar, the whole house is vulnerable. I why I'm going to speak on this because my question that I ask often to myself is why is it that the recovery community cannot find middle ground? They're always fighting and arguing. And I believe because both sides are afraid. The pro MAT side is afraid people will die without medication. The anti MAT side is afraid people will stay dependent and never truly heal. Both sides have a concern worth listening to. The problem is, instead of listening, we start labeling. Yo, you're not really sober. You're ignorant. You're killing people. You're just replacing one drug with another. You're brainwashed by those doctors. You don't understand science. And while we argue, guess what? People are dying. See, the middle ground is this, folks. MAT can be life-saving. Medication alone is not complete recovery, though. Abstinence can work for some. MAT can work for others. Every person needs a full recovery plan. The goal is not just survival. The goal is transformation. And you know what? I'm about to hold you. This is what I'm going to speak on right now is accountability for those people that have a voice. If you have a voice in the recovery community, you have a responsibility. Yo, don't shame somebody on MAT. Don't tell somebody to stop medication without medical guidance. Don't act like medication is weakness. But also, don't tell people medication is all they need. We need to stop selling partial recovery as complete recovery. If someone is on MAT and it's keeping them alive, yo, praise the one true living God that they're alive. Now ask, are they healing? Are they growing? Are they learning coping skills? Are they dealing with trauma? Are they rebuilding relationships? Are they connected to behavioral health? Are they developing purpose? Are they preparing for life beyond crisis? That is the conversation that I'm bringing out to you all. And let me end with this, guys. MAT is not the enemy. Addiction is the enemy. Isolation is the enemy. Shame is the enemy. Misinformation is the enemy. Pride is it. Pride in the recovery community is the enemy. Medications may keep someone alive, folks, but community, truth, behavioral health, accountability, faith, structure, and the renewed thinking help everyone in recovery. So maybe the question is not, yo, are you pro MAT or anti MAT? Maybe the better question is, are you pro healing? Because if we are truly pro healing, then we will use every ethical, evidence based, life saving tool available while still calling people higher. Not just alive, restored. Not just medicated, rebuilt. Not just surviving, but free. MAT may keep the body from crashing, but recovery has to teach the person how to live without escaping. Till next time. Peace.